Congratulations on the birth of your baby. We have made this film to answer some of the questions you may have as a new parent. You can watch this video as many times as you like through our hospital's website. If you have any questions, please contact your midwife or GP.
Hi, I'm Nicola, your midwife. I am here to make sure you know all of the key things about going home with your new baby and help to make this step as easy as possible. Getting to know your baby. As you get to know your baby, you'll know what is normal and what is not normal. If your baby is becoming unwell, you may notice a change in their behaviour. They become very sleepy, develop a high-pitched cry, become very pale, become very red, or develop a rash which doesn't fade, passes pale or chalky stools, or passes very dark urine. Feeding. A mother's milk gives your baby all the nutrients he or she needs for around the first 6 months of life. It helps to protect your baby from infections and other diseases and reduces the mother's chances of getting some illnesses later in life. Breastfeeding also helps mums and babies get closer physically and emotionally. So while you're feeding your baby, the bond between you grows stronger. Support for breastfeeding is available in the hospital and community, but please try to join one of the breastfeeding workshops before you go home. If you choose to bottle feed your baby, it is very important that you follow instructions on sterilising feeding bottles and equipment and preparing infant formula feeds. If in doubt, please ask your midwife. Sleeping. To keep you and your baby safe, it is important to make sure your baby sleeps safely, both day and night. The safest place for your baby to sleep is in a cot by the side of your bed. Registering your baby's birth. In the UK, babies must be registered within 42 days of birth. Failure to do so may result in a fine of up to £1,000. Registering your baby with the GP. Once a birth certificate is obtained, your baby can be registered at any GP surgery. Prior to obtaining a birth certificate, you can take the baby to the GP that mum is registered with. 6-week check. It is a good idea to book the 6-week mother and baby check together around 4 weeks after delivery to ensure the appointment is made on time. This is also a good time to discuss contraception. Pelvic floor. The pelvic floor muscles help you to stay continent. These muscles are stretched and strained during pregnancy and childbirth. You should aim to do pelvic floor exercises at least 60 or more times per day. So, how do you do them? First, squeeze your muscles like you need to hold your wee. Then, hold for 10 seconds and release. Don't hold your breath. Try to repeat this for 10 more times. Try to incorporate these into your routine, such as when feeding baby or brushing your teeth. The more you can do, the better and stronger your pelvic floor muscles will become, helping to prevent leaks when you laugh, cough, or sneeze. The Red Book. Your baby has been allocated a lifelong number from birth for the NHS. This number will be available in the Red Book. The Red Book contains lots of useful information about your baby's health. This includes detailed information about the immunisation programme for newborn babies. You can arrange these through your GP at the 6-week check. Car seat. We strongly recommend that you use an approved car restraint or a car seat to take your baby home. Care at home. Normally, I will discharge you and your baby when your baby is about 10 to 14 days old. The health visitor will visit you a few days after this and will advise you on further follow-up of your baby's progress and your baby's immunisation programme. If they have not contacted you within a week, you should inform your GP surgery. Even if the midwife is no longer visiting you, you are still able to contact them and seek their advice or a further visit up until your baby is 28 days old. More questions? We have provided more information in our Guide to Postnatal Care at Home booklet.
Hello, I'm Kerry, your paediatrician. I am here to help you with important things to know about your newborn baby. I want to make sure you go home knowing what is normal and what is not normal. Dirty nappies. Within the first day of life, the baby will pass meconium, a thick, black, tar-like stool. This continues for the next couple of days before becoming yellowish with seeds. The frequency, consistency, and colour will change depending on what the baby feeds on and your diet if you are breastfeeding. Breast milk tends to be absorbed better, so the baby may open its bowels less than you might expect. Please let the midwives know if your baby hasn't passed any meconium by the second day of life. If your baby's poo is ever red or white, please seek help. Wet nappies. Different babies wee different volumes and frequencies throughout the day. It is not normal for your baby to stop weeing. Please see a doctor, as this is a sign of dehydration and needs to be corrected. There is a chart in your postnatal booklets about the expected number of wet and dirty nappies per day of life. Vomiting. A small amount of milky vomit after feeds is normal in a baby. This can mostly be prevented by good burping and not laying the baby down flat, straight after feeds. A little bit of reflux in a baby is normal, and it will improve as the baby grows. The need for medication is rare. If the vomit is ever red or bright green, you must seek help. Umbilical cord. The umbilical cord will fall off by itself in the first week of life. As the cord shrivels, it will ooze a jelly substance out. This is normal. Please seek help if there is a lot of bleeding, signs of infection such as a bad smell, or redness of the skin around the cord. Skin. Don't worry if your baby has acne or a dry scalp. This is normal. If your baby ever goes blue around the lips or has a rash that doesn't disappear when you press on it, please bring your baby to A&E straight away. Some breastfed babies can be jaundiced on day 2 or day 3 of life. Please let your midwife know if your baby's skin turns yellow, worsens, or your baby becomes difficult to wake. Breathing. Babies breathe through their noses, and they may sneeze or sound snuffly in the first couple of days, whilst they clear their airways of fluid. If your baby looks like they are struggling to breathe, or has persistent noisy or wheezy breathing, then this is not normal, so seek help. Temperature. If your baby is under 3 months and has a temperature above 38 degrees Celsius, please seek help in A&E. Invest in a good digital thermometer as they are the most accurate. So just to recap, if your baby stops waking for feeds, stops feeding, stops weeing, has green vomit, has a high temperature, is struggling with their breathing, or you are concerned that they are just not right, then please get a doctor or a midwife to check your baby.
Hi, I'm Iraine, your obstetrician. I am here to help you know how to look after yourself after having a baby. Having a new baby brings many challenges, but it is important to look after yourself. Perineum. Vaginal pain and discomfort is common in the first few days. Pouring warm tap water over the area whilst passing urine may reduce stinging. Stitches normally start to dissolve and the area heals in a week to 10 days. If you have any concerns, make sure you let your community midwife know. Pain relief. Paracetamol and ibuprofen are the recommended painkillers after having a baby, as they do not cross into the breast milk. If you cannot take these, or they are not enough, please let your midwife or doctor know. Painkillers containing codeine can cause constipation, so you may wish to avoid them, as constipation is very common after having a baby anyway. Sleep. It is normal to lose your normal sleep pattern when you have a newborn baby. This can make you feel irritable and tired. Try to sleep when your baby sleeps. Cesarean section. A cesarean is a major operation, and it is likely that you will feel tired, and it can take time to recover. Don't be afraid to take painkillers. Check with your insurance company about driving, but normal advice is to wait 4 to 6 weeks before you can drive. Mood. It is common to feel a bit low after having a baby. This is commonly known as the baby blues. Make sure you seek help if you are feeling very tearful and things are not improving by 10 days after delivery. Support. Get to know the other mums on the ward with you. Maybe you could swap contact details and stay in touch. Having someone to chat to when you become a new mum is a very important type of support. Contraception. Contraception is not necessarily something you are currently thinking about, but it is important to consider it as soon as possible. There are many different types, and the postnatal booklet explores these in more detail. If you are breastfeeding, you may not have periods, but you can still get pregnant if you have sex. Medical problems in pregnancy. If you had an issue with blood pressure, obstetric cholestasis, a third-degree tear, or concerns with the baby's growth, please make sure you read the appropriate leaflets in the racks for advice about managing future pregnancies. When to seek medical attention. If you are suffering from headaches, a sore throat, a fast pulse, fast breathing, a rash, leg pain or swelling, fevers, temperature, smelly vaginal discharge, or concerns about your wound healing, please make sure you ask us or come to see us. Concerns or uncertainty about your antenatal care. If you are unsure about anything that happened during your pregnancy or labour, please feel free to ask your midwife or doctor. If you are still left feeling like you have questions, we have a birth reflections clinic where you can talk through the events of your pregnancy or birth once you have been discharged from hospital.
We hope you have found this video useful. For further information, please use your postnatal discharge book, which covers everything in greater detail. Please don't forget, if you have any questions or concerns, your midwives and GP are contactable by phone, and A&E is open 24/7. Our address is Whipps Cross University Hospital, Whipps Cross Road, Leytonstone, London, E11 1NR. Here are some useful telephone numbers. And our website is www.bartshealth.nhs.uk.